Your mother always said an apple a day keeps the doctor away, but does it really? And what about all this talk about vitamin D? Do we really need all that vitamin D? Our next guest is a well-respected doctor whose new book, Dr. Chopra Says, Medical Facts and Myths Everyone Should Know, answers all kinds of questions just like these. And Dr. Chopra is with us this morning. It's great to see you this morning.
It's great to be on your show.
Well, thank you, sir. Now, you were not the sole author of this book, you were telling me.
That is correct. I had the privilege of writing it with a good friend and colleague, Dr. Alan Rotwin, who used to be a cardiologist at Columbia Presbyterian.
Great. And you guys have put together what I think is a fun medical book, because you can look up your issue, you can find it, you can get some information about it, and then we can learn what you personally think about that particular issue, whatever it may be. For example, taking vitamin D.
Right. It was a lot of fun for us to put this book together.
It's amazing how many myths there are out there when you talk about medical issues, aren't there?
Right. You know, we're barraged every single day with a mountain of information, but I also say misinformation related to health issues. And if you were, Kim, to go to your primary care physician tomorrow, he or she, if you said, coffee, I heard, is a miracle drug, would likely say, the refrain would be, everything in moderation. These studies come and go. The next one might well debunk it. Right,
right. That's a perfect example of it, is coffee. You know, one day I'm supposed to be drinking it, the next day I'm not. One day I'm supposed to drink a lot of green tea, and the next day it's not doing a darn thing for me. I'm just drinking a lot of green tea.
That's
so
correct.
This is part of what makes the book so great, because you do set us straight on some of those issues. If you were to give our viewers one medical tip right now, a myth that exists that you would like to debunk, what would be the most important one?
I think the most important one would be that we need to take multivitamins and all kinds of vitamins and supplements. Unfortunately, in our country, it's a multi-billion-dollar unregulated industry. Vitamin E, even in moderate doses, may actually increase cardiovascular mortality. Vitamin C in large doses can lead to kidney stones. The only vitamin we should be taking is vitamin D3, the sunshine vitamin. So that's actually also part of the mnemonic called Aced Life, which we'll probably talk about later.
In fact, we'll talk about it right now. Let's do it. You have, and it's really a neat thing, you and I were just talking about, a good acronym always helps everyone.
Right.
And in your book, this is a theory that you live by, and it's Aced Life.
Right.
So let's go through that. What is an Aced Life?
Right. So, you know, if a friend of ours were to live to the ripe old age of 108 years, perhaps in the eulogy somebody would say, this person was a great person, was a man he or she aced life. So aced life is aspirin. All of us should be taking aspirin. If you're over the age of 45 years as a woman, you're automatically at risk for heart disease. 45 for a man and 55 for a woman.
Okay.
And if you're not taking aspirin, we should carry it. We should carry it in our car, in our golf bag,
just
at
in
work,
case.
just in case we have that crushing chest pain. Chew 2 baby aspirin called 911, and it can save your life. Aspirin, it turns out, can also decrease the risk of colorectal cancer, prostate cancer, and breast cancer. So the A is for aspirin, C is for coffee, and coffee has miraculous health benefits, protects against liver disease, type 2 diabetes, Parkinsonism, and gout. And by the way, none of those studies have been sponsored by Starbucks or Dunkin' Donuts. So E is exercise, which is really the best drug.
Right.
And even simply walking 10, 15 minutes a day has miraculous health benefits.
Terrific.
D is D3, vitamin D3, 1,000 to 2,000 international units a day. Multivitamins contain only 400 units. That's not enough.
Right.
L is laughter. We need a lot of laughter in our life. Laughter is also the best medicine. I is to go inward, to meditate, to reflect, to have some silence every single day in our lives. F is fish or fish oil, and E is empathy.
Okay, now wait, let me go back to fish or fish oil.
Right.
How much of that do we need?
You need about 850 milligrams of fish oil. Now, if you don't like fish or fish oil, you can have walnuts. Walnuts contain omega-3 fatty acids, the same as fish or fish oil.
Okay, terrific.
So L is laughter, I is to go inward, F is fish or fish oil, and E is empathy. In the Talmud, it says, compassion is the highest form of wisdom. His Holiness the Dalai Lama, who embodies tranquility, wisdom, serenity, once said, be kind whenever possible. It is always possible. He also once said, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. So Aced Life is the mnemonic, and don't go nuts remembering it. So nuts are very good. Other than Macadamia nuts and coconuts, all the other nuts, pine nuts, peanuts, cashew nuts, almonds, walnuts, increase longevity by 2 years.
I think I hear you saying, bring some nuts into your life.
Right. Yeah. Bring some nuts into your life.
Dr. Chopra has a book signing coming up tomorrow night, gang, and you'll want to get out and meet him. And be sure you pick up this book because, honestly, this is a book that you want on the shelf at the house because you can refer to it throughout your day and throughout the year. It's tomorrow night, 7 p.m. at Porter Square Books in Cambridge. Be sure you check it out. Doctor, thank you so much.
Thank you
Great
so
to
much.
see you again.
Great
We're so
to
glad.
see you.
Continued success with the book.
Thank you.
We'll take